Hi, everybody. This is Adam Rossen from the Rossen Law Firm, and what we wanted to do was just have some local community leaders and do a therapist roundtable today to really just discuss some issues that therapists are facing in the local community with the coronavirus pandemic going on, how it's affecting their clients, how it's affecting their businesses, and really what are they doing to be community leaders. So I have three expert therapists with me here today. Thank you, everybody, for coming. And I have Brian Pagan from Brian Pagan Counseling Group in Boca Raton. Hi, Brian. How are you?
Well, how are you, Adam?
Good, good. Great to see you again.
Thanks for having me on.
Of course. I also have Liza Piekarsky from Retreat Behavioral Health, and she is also in private practice with Caring Therapists. Retreat is a drug and alcohol treatment center in Palm Beach County. How you doing, Liza?
Hi, thanks for having me.
All right. And last but definitely not least, Amanda Patterson, the owner and therapist at Caring Therapists, when they have offices in Davie and Wellington. How are you, Amanda?
I'm excited to be here. Thanks for having me.
Good, good, good. Well, listen, I think this is really important, valuable information that people need. You know, in the last 3 weeks, our world and lives have changed forever. Our businesses have changed forever. So we watch the news and it's just, we're inundated with all of this stuff. But I think it's really important for us at a local level to really talk about what we're seeing and what we're doing, to help our people, help our community. So first of all, I want to hear from each and every one of you just a little bit about your background and education, just so we know who you are and what you do. So Brian, we'll start with you.
Okay. Hi, guys. I am a licensed mental health counselor. Been in practice since 2012. I'm also a certified addiction professional and a certified trauma therapist and a qualified supervisor. In my practice, I do individual psychotherapy and family. I work with a lot of teenage males suffering with mood disorders, failure to launch, failure to thrive, substance use issues, as well as adults with that, and also work with some more co-occurring dual issues, more severe personality and bipolar disorder and some of those issues as well. My practice is in East Boca.
Perfect. Okay. And so Liza, tell us a little bit about your education and professional background.
Yes. So I am a licensed mental health counselor, certified addictions professional, qualified supervisor. I'm currently in private practice with Caring Therapist of Broward, where I primarily treat adolescents, young adults, those struggling with addictions, behavioral issues. That's pretty much my area of expertise. And then I also am the regional director of marketing for Retreat Behavioral Health, where we specialize with not only substance use, but we also specialize with primary mental health with our ACA license.
Okay. Perfect. And so Amanda, tell us about your background and experience as well.
So I'm Amanda Patterson. I am the owner of Caring Therapists. It's Caring Therapists of Broward and Caring Therapists of Palm Beach. We have an office in Davie and in Wellington. And I mostly specialize with depression, anxiety, trauma, young adults to, sort of like into their adulthoods. Our group practice specializes the same kind of things: depression, anxiety, trauma, and couples counseling. We work with children, as young as 4 or 5, and then all the way up. Same kind of, mental health issues. And I am also the admin of my private practice collective. So if you're watching and you're a therapist, we'd love to have you join. More conversations there. We're all there, always sharing good resources.
So Amanda, I was actually going to ask you about that group. So you want to just tell us a little bit about the group and how that started?
Sure. I can't remember now if it was 3 or 4 years ago, because it's been kind of a few years now, but it started out really like as a marketing group. We were just doing a marketing challenge. I just decided to do like a 30-day marketing challenge, and a bunch of us really centralized in South Florida had decided to do this together. And when our challenge was done, we came together and said, what do we want to do with this group? And they're like, hey, let's keep it open. It's been fun. And it's grown now to over 13,000 members in I think it's been 4 years. I can't imagine that it's only been 3, but I have to check my stats on that. And we just get together every day. I do live videos in there. We have people sharing resources, asking questions. It's really a lot of practice building, a lot of connection. There's been a lot of really great connections made from that group. Like people got to know each other really well. It started really in the beginning. It was like, oh, Florida, Florida, Florida. Now it's really across the nation and really across the world. We have clinicians from all over the place. So it's a pretty cool group. And there's been a lot of questions about this and what are we going to do with our practices.
Right, and I do want to thank you because I've been in the group for about a year and a half, and as an attorney, whenever I have questions for therapists, I post in there, and I get some amazing feedback from the therapist, and you know, I think it's just amazing to have a resource such as that. So I love the fact that you have that group and that people in there can really get help and mentorship from others, whether it's 2 miles away or across the country. So that's amazing. So now, each of you own your own small business, right? Just like I do. And also, Liza, you work for another business, the Retreat. So, but as business owners, how are you folks handling the coronavirus pandemic, just from a small business ownership perspective?
You know, at the beginning, a few weeks ago, I just started emailing and reaching out to all of my clients and letting them know that I was going to be transitioning to telehealth as more information came out on Corona, and offering, letting them know the different ways to access that, what the sessions would be like, and just make sure they knew that they could still reach out to me via text and email for scheduling and changes and any issues going on. I had been prior still going into the office and do my sessions, in the office, but just recently I decided to go ahead and stay home and start working primarily all from home. In the business aspect of things, not much has changed as far as scheduling for me. I'm having a lot of clients from past years reach out, and my schedule's actually been very, very busy right now, trying to get in as many people as I can to help them manage what's going on right now.
I could speak on more so of a larger business scale with Retreat Behavioral Health and some of the steps that we've taken at Retreat to ensure the safety of our clients and continue to be able to service the population, because we know that addiction, mental health, and behavioral health doesn't sleep. So we are considered essential employees, all of us, and we need to ensure that we're still out there providing the services that we offer. So about 2 to 3, I would say 3 to almost 4 weeks ago, when this really started to pick up, Retreat was on the ball immediately and started sending out information, daily tips, and really just starting to take precautions with everything that was going on. So at this time, some of the things, there's a variety of things that we're offering and doing to change the services, but everybody is getting their temperature checked as soon as they enter in the facility. Employees, staff, patients, our outpatient practice completely moved to telehealth within the first week. So I think Retreat was pretty much ahead of the game with that. We're not taking patients in from other states right now. When they put a mandate on New York, Connecticut, and Pennsylvania, we eliminated accepting clients in from there, not allowing clients to travel in via airplane. So there's so many different precautions we took. Our doctors are actually seeing the clients via telehealth, whereas the nurses, of course, the nurses are there. We're still operating a 24-hour medical detox residential treatment center, but there are so many precautions that we are taking at this time.
Okay, great. So Liza, when a new patient comes through, are you still accepting new patients at this time?
Absolutely. We are accepting new patients. Of course, there's daily updates. So this is not something that we can say today is going to be the same as tomorrow. Every day we're getting a daily tip from our corporate medical director of different things on hand washing or face masks. And then we also get from each executive director, we're getting daily emails on just different changes that are occurring in terms of admissions. We now have a nurse in our admissions office doing COVID screenings for all of our patients prior to coming in. If we're doing pickups, their temperature is getting, they're checking the temperatures. So there's so many different things happening, but we are still fully operating detox all the way out to outpatient.
Okay. So Brian said that he's noticed a bit of an increase in old clients of his maybe reaching back out in times of crisis and stress. Liza, have you seen an increase in admissions?
Our admissions have, stayed pretty stable throughout this. I think there's definitely a fear that it's going to taper off. But again, as I said, addiction and mental health does not sleep. So whether we see an increase now or an increase down the road, right now is the tip of the iceberg with this whole COVID, and everybody is presenting with, a lot of the population is presenting with symptoms, but what we're not seeing right now is the layers underneath, the mental health that's building up, the addictions, all that stuff that even if you didn't have prior to entering into this social isolation, or as I would say, social separation and physical distancing,
right.
You're going to start to see more of it. So we need to be proactive and make sure that we're readily available for those patients coming in.
Amanda, as a business owner, but as a group practice owner, can you share some thoughts on what you've done and what you've seen, not only for the clients that you've seen, but also the clients that are coming in the group and all of the different therapists and their specialties that work under you?
It's interesting because when you have a group practice, the numbers just start to look different and like the impact is different. And so what I did, especially like as we were rounding out the month, right? Like this kind of happened in some ways like at a good time because it started in the middle of the month where rent was already paid, a lot of things were already paid. And so now I think as rent had to be paid again, and then now thinking a month later, rent and different bills are going to have to be paid. I started to look at numbers and look at the first 2 weeks of the month, how many sessions did we have? The second 2 weeks of the month, how many sessions do we have? I actually compared those numbers to see, and luckily it was actually higher in the second 2 weeks when this started happening. So that was a good thing, though we've seen a lot of cancellations. We've also seen a lot of people, the same like Brian had mentioned, like that have reached out, want counseling. We saw a really big dip in our intakes. Normally we do, let's just say about 8 intakes a day. Like we book 8 intakes a day. For about like an 8-day period, we saw like maybe 1 to 2 intakes. Then this past Friday, we booked 4 intakes. So that was kind of like a positive thing. And so I'm really big on tracking. And so I can see the ebbs and the flows of the business. I think that what's going to happen, kind of like Liza just referenced, is that things are going to start to build up, and that when we kind of go back to normal or the new normal, that the doors are really going to, like flood open. I think a lot of people are really going to need services. I think we saw a lot of cancellations sort of like 2 weeks ago because people were like, oh my goodness, like, what's happening? And then now as children are not going back to school at all, people are really not looking to go back to work until maybe June 1st. That's kind of the number that's been thrown out. People are acclimating to this lifestyle, right? They're acclimating to being at home. They're acclimating to doing all kinds of things from home, and that they're acclimating again to doing therapy from home. And so I think that while some people may have seen an initial drop off, and we've seen it, some of my clinicians have seen an initial drop off, I think that over the next coming weeks, it'll continue to go back up.
So for new clients and what you call intake, are you doing that over telehealth now?
So we are doing that over telehealth. We're still seeing some people in office. There are just some things that we do that can't really be done over a telehealth, like some testing. For instance, like you can't, do like an MMPI, I think, some kind of like physical test that somebody has to do. Maybe I guess there are some ways. We're just not designed for that. So there are some things, yes, we're doing in office. So we're not 100% fully online, but we're doing the same thing, taking precautions, having supplies, having people. We have anybody who's coming into the office, which is, I would say, has been reduced. I would say maybe about 80%. So we're doing about 80% online and 20% in office. Same types of precautions, screening people. People are waiting out in their cars. They're not waiting in the lobby. We sort of took away like the coffee maker. I had to like put the coffee maker away. It's something small, you know,
Right.
but like people really love that. But that was like the first thing we had to get rid of. Cleaning the office, washing hands. As soon as people come into our office, they wash their hands, and they go into their session.
All three of you mentioned telehealth, and have you had any guidance from your state boards on what telehealth apps you can use or not? For example, can you use FaceTime? And I'll give you an example in the legal profession. About 3 weeks ago, when everything was getting really serious, the Florida Supreme Court wrote an emergency order allowing notaries to basically notarize documents, over video, as long as the proper precautions are taken place. So at least the legal profession was a little bit ahead of that, which has worked out pretty well for us with our clients, with just getting important documents signed. But I could see their issues about people debating whether or not FaceTime is HIPAA compliant and so on and so forth. So what have each of you heard, and what kind of guidance have you had?
I know that there has been some guidance released. I was already set up for a HIPAA compliant telehealth medium. I use DoxyMe, and so I've just rolled right into that. I've had several that were wanting to use FaceTime, and because they were weary about having to download something or how complex it would be to use a HIPAA compliant method, and I just had to talk them through it. And it's a very simple process. Just invite them via email or text, and they join on without having to download any kind of any download to their phone, iPad, or laptop. So as far as that goes, it's been pretty easy. I do deal with primarily your teenage and early 20s era, and so a lot of them are very comfortable with that method of communication already. So it's not a big leap for them. So it's been pretty seamless transition. I've had a few that have preferred, like Amanda said, to do it in person. And so up until about a week or two ago, I was seeing a couple people in person, but I have since transitioned to, some of the trauma cases are very hard to do via telehealth, and really do require, I've had some acute trauma issues with some clients over the last couple of weeks, and for those just kind of needed to be in person. And so you do have to use a little bit of discernment there, doing the screening with them, questioning, who they've been around, having them take their temperature, all that kind of stuff. But the telehealth is pretty simple process. I know there's a lot of different Simple Practice, DoxyMe. There's a lot of different methods to use it that are HIPAA compliant. So it's not that complex.
Kind of like how millions of people have now downloaded Zoom that never had it before, right? Just exactly. And so, Liza, have you had any issues at the retreat with telehealth?
No. So, of course, I'm not behind the scenes, but I know that they've navigated through everything to ensure that we are HIPAA compliant at retreat with all of our telehealth practices. We're also an in-network provider with insurance companies. So I know initially the different insurance companies had their own, guidelines. So our team has been in contact with DCF, the different insurance companies, licensing, JCO, every different entity to ensure that we are following their guidelines and providing the ethical care. I know a lot of different places, like Amanda for private practice, I don't really have to worry too much about that because she's doing all the research and providing it to us in terms of what we should be doing as private practitioners. And I know that some of the providers have also given free, it's like ethics on telehealth, where it was like $500. They're now waiving the fee and doing them for free. So we encourage everybody to go ahead and enroll in that and make sure that they're practicing ethically.
So Amanda, as the business owner, and how many therapists do you have working in your group?
There are 15 of us.
Okay, so 15, wow.
Mm-hmm.
So you have 15 therapists working in your group, and how have you handled telehealth, not just for you and your clients, but for the other 14 in your practice?
So we were basically already pretty much set up for telehealth because we run a pretty technologically advanced practice. We actually use Google Meet because we use G Suite to run the practice. That's what everybody has an email through G Suite. We use Google Sheets. We use all of the different functions of G Suite. And when you pay for G Suite, you can get a BAA. I think it's $12 a person if you're just an individual, and then $6 each additional person that you add onto it. And then you can use Google Meet, which is 100% HIPAA compliant. So it's really easy for us to just transition there. I think I was using it anyways for a lot of my online. I was using it anyways for a lot of my online sessions that I was doing. We just made sure to shore up like our paperwork. We use therapy notes for our electronic health record. And with that, you can just send all the paperwork through a portal. We had everybody fill out the telehealth consent form, and everything was pretty seamless to get everybody online. I'm of the thoughts that we should be following HIPAA, just because it's been suspended at this time, we need to follow it anyways. But I will say, in cases of for whatever reason, I had one client who couldn't get on Google Meet at that particular time. I said, listen, we can use FaceTime. It's not, compliant, but we can use it. And they were fine with it because the HIPAA relies on the client, not the clinician. Granted, we have to explain all of the, HIPAA to our clients, and we have to have a HIPAA compliant practice. But if our clients decide hey, I want to take my assessment you did for me and post it on Facebook for the whole world to see, that's not our, we're not liable for that. Just in the same way, if our client says, yes, I understand the risks of FaceTime, I want to use FaceTime, then we can use FaceTime and those kinds of things. I don't recommend that is the first, line of defense, but because a lot of platforms are not ready to handle the amount of people that have been on them. Even a company as big as Zoom has had a lot of technical difficulties. Luckily, right now we've been good, knock on wood. But yeah, I was, trying to get on a call last week. There were some difficulties. I think we have to have contingency plans. And that's been, at least for me personally, is having contingency plans. Some of the clients even have said to me, I think you're wonderful. I don't want to see your face. I don't want to see anybody's face. I've been on a screen all day. Can we just do a phone session? A lot of the companies, insurance companies, for instance, have come out and said that's okay. And so that's been kind of a good plus, is that a lot of the insurance companies have come forward and said, here's the rules we're allowing right now.
Good. So have you folks received a lot of positive guidance from either the insurance panels on what you can and can't do, and your state and local boards? So
I'm getting emails every day. FOMCA is our association. They sent out a lot of resources. Aaron Norton, who is the president, sent out this full not press release, but a full release on what they could do, what we could do. They have a forum where we can go ask questions. They had emergency meetings about registered interns that are allowing registered interns to do telehealth and now to do intakes via telehealth, which was a really big thing because a lot of registered interns were oh, I can't take any more clients.
Yeah, Aaron's fantastic. I did a few webinars with him last year for FOMCA, and he's great and he's so dedicated. So we'll give that shout out to Aaron. Now, specifically from your clients, what kind of issues are you hearing from them? Are they talking about regarding coronavirus?
Like I mentioned earlier, I kind of treat two different populations. I have a big teenage population and then adult. I'm seeing a difference between the two. Most of my teenagers in the first 3 weeks were pretty chill. They were laid back and relaxed. They were at home. They were getting their Netflix, their all their phone time, their video gaming, not overly concerned until I would say this past week when a lot of them started back with the online school. And then I started seeing some of the anxiety come back up. Aside from the anxiety, just anyone who has had any pre-existing or has any pre-existing mental health issues, depression and stuff. One of the big issues that I'm seeing is getting out of routines. When you're dealing with depression or anxiety and just stress management in this world, today's day and age, routine is very critical. And without having the wake up times, and mom and dad aren't on these teens to go to bed right now because they don't have to get up and get ready for school, I'm seeing a lot of regression in eating, sleeping, and exercise habits, and also purpose. So that's one of the things I've been focusing on with a lot of my teenage population, is even though they have a 3-month, 4-month, however long, we don't really know right now, break from their normal routine, I'm really encouraging them to develop a new routine, develop a new schedule with bedtimes, wake up times, eating schedules, what kind of exercise they can do in the home, getting outside, to help maintain that healthy mental status. With the adults, there's a lot more fear and anxiety and stress that I'm seeing over, the financial issues. A lot of the older adults have parents or grandparents that are in the more risky, age demographic for what we've got going on here. So in those groups, it is a whole lot more of mindfulness, using the cognitive behavior therapy to help them identify the fear and unhealthy thought patterns, focusing on what they can do versus what they can't do. So I am seeing a lot more fear and anxiety in the older populations than I am the younger.
And so, Liza, with people who have addiction and are now basically being confined to their homes, and some of their homes might not have been the most stable place to begin with. For example, in what we do, criminal defense, there hasn't been any of the proactive police enforcement. They're not doing DUI checkpoints, DUI saturation patrols, but we are hearing of quite an increase in domestic squabbles. Family members just getting into it, and everybody kind of getting that cabin fever. So when you see what we have now with the social distancing, the new stay-at-home order, but then you add that to substance abuse issues. What have you been, from the retreat's perspective and just your perspective, what have you been hearing? What have you been seeing?
There's definitely, I can't really speak from retreat's perspective, more so just what I'm hearing and seeing is that there's definitely an increase in substance use. The reality is yes, we are home and we're not able to be out there in the community, but the resources are still there. So if you have access, given that you have access to telehealth or computers, there's still AA, NA support groups. So many platforms are offering free meditation, different apps and different websites are offering the same services. It does become a little tricky because we know when you're self-isolating, when you're in active addiction, the motivation, even not necessarily addiction, but depression or any other mental health diagnoses, you do struggle to find the motivation to engage in these resources. So it is a little bit more challenging, but I encourage everybody to take advantage of all the services being offered to you on a daily basis.
Have you heard of any specific AA or NA classes or groups going online? Because, as we know, the social component, the accountability component, the having a sponsor, having that, being able to go to a place, be around 15 or 50 of your peers and share is so critical to people in recovery. So what have you actually seen from AA or NA?
You can access them online. If there's websites, I don't have it specifically on me, but you can access all of that online. And it's pretty cool because even on Facebook, I've seen so many people on Facebook posting that they picked up their chips, whether it's 1 year, 30 days, 6 years, they're picking them up and they're posting it. So things that I might have not had an opportunity to see or people might have not shared before because you're at your home group, we're seeing that more and more, and it's really spreading throughout the community. And I think that's beautiful to watch so many other people be able to pick that up. So there really is no lapse in that. It's just it's a new norm of doing it, but it's connecting with so many other people and sharing that.
Because I've gotten that feedback from my clients as well. Because one of the very first things we did, I think 3 weeks ago when we transitioned to working mostly from home, is we just divvied up our entire client list and we called every single client just to ask how they're doing, forget about the case. I mean, we gave them a little bit of case updates, but really it was just, how are you? How's your family? What's going on? And for any of our clients that were in treatment, we were asking them questions, because for me, we're not really on the front lines of their substance abuse or mental health issues. And so for me, it was really educational to ask what they've been doing and how they've been doing it. And we did hear a lot of our clients have been moving to telehealth for even just AA or NA. So that's fantastic.
It gives you the opportunity to connect with more people, believe it or not. You would have never picked up and reached out to 20 different clients that you were seeing that maybe haven't been in a month or so, but this is giving you the opportunity to connect further.
Oh yeah. Yeah, all of my clients were extremely appreciative that they just got a call from us saying, hey, forget the law. If you need anything, we're community leaders. We care about our people. Call us, talk to us. Whatever you need, we can put you in touch. Either we can help you directly or put you in touch. So that's been nice.
I know on the AA front, several of my clients, the chairperson of their home group has been organizing Zoom meetings at the standard time of when their home group was. Okay. So I know a lot of mine have just reached out to their sponsor or their peers or the chairperson of the home group if they have their direct contact information, and they're giving them the Zoom invite, and they're holding a lot of those meetings just through Zoom at the standard times that they normally would be holding them. Perfect.
Well, I'll give you an example. So my firm on Friday we had a virtual happy hour. Just to it's been quite an adjustment. There's 6 of us in my firm, and we just had everybody on GChat video. And we just all, hung out and talked Friday, 5 o'clock, because we've really missed the daily human interaction, not just daily, but even every hour, every few minutes, just walking into somebody's office, everything that we do in our business. So, and it was great. It was just a lot of fun to find out, what everybody's plans were, how everybody's been coping and handling that. So I think we're going to institute that even more. Amanda, I wanted to ask you, as far as, I know anxiety is one of your big specialties. So have you had clients who have been managing their anxiety, but now this global pandemic is happening. People are getting sick. People are dying. And have you had clients, either yourself or in your practice, that have just, think they have it, or have gone to the hospital, or have been, hyperventilating, or had panic attacks? What have you been seeing from, especially with that anxiety factor?
So it's kind of interesting, because for a lot of people with anxiety, they're catastrophizers, and so they think the worst. And so they're actually coping pretty well with this, because they're like, I've been planning for a catastrophe my whole life. Like, I've got this. I know what to do, right? And so for a lot of people that I see, a lot of them are coping. They're coping pretty well, because 1, they've been seeing me for a little while. They have some coping skills, but 2, they're used to being in chaos. They're used to, especially people who have PTSD, I've noticed they've done really well with this, because they're used to living their lives in chaos. They're used to things, being hypervigilant to things. They're used to having to respond in a different way to stressors than maybe the rest of us do. And so that's been kind of interesting to watch. On the personal front, I know a lot of people that have started to have panic attacks, people who are generally high functioning people in everyday life, maybe, more on the neurotic side or anxious in their disposition, but generally function very well. I think one thing that I've seen is a lot of moms have really been struggling with panic attacks, because they have children. And they're worried about their children. They're worried about their children going back to school, what kind of slides that their children are going to have. Like, are they going to not be prepared for the next grade? Are they not going to be having as much social interaction? And what is that going to do for their socialization? And then on the flip side, like, trying to manage, their Zoom meetings, their children. I mean, I know Liza could definitely speak on this, like how to handle like working and my child and my husband and the dogs and the cats and dinner. And now people are like women especially are expected like to keep their house clean. Their housekeepers may not be coming to their house, and I understand that might be a first world problem, but that's also like really stressful to people, especially women who are already like spread thin, right? And so now they've got to feel this pressure to homeschool their children, right? There's moms out there making these massive like schedules like every single hour, and it puts a lot of pressure. And so I happen to work with a lot of moms in my practice, and that's where I've seen the anxiety coming from. Not really what's going to happen to them. They're not going to the doctors. They're not going to the grocery stores. They're ordering in their groceries, but what's going to happen with their children? And not are their children going to get sick, but what's going to happen when they return back to school, and what is the new norm going to look like? That's, I think, a major stressor. And then we work with a lot of healthcare professionals at our office. Like people are they've completely stopped doing their normal job and they're making masks or helping make masks. Like for, different hospitals. They have completely had to shift over, like a lot of nurses who work in one particular unit have transitioned and are working exclusively like in ICU or in other areas. And so I think they're used to coping with a large amount of stress, but they're just having to change their purview of how they're looking at things. So I think I don't know that you can put a trend on it. It's just I've seen people who are usually anxious but have been in therapy for a while manage well, but people who have children are not in therapy or have had to stop therapy for whatever reason, an increase in panic attacks.
Okay. So that's, that's a great transition because, for example, I have an 8-month-old. He just turned 8 months today. And my wife and I both work. We're both attorneys. And so we've struggled a bit ourselves. And Brian, I know you have 2 children and you have a newborn as well.
Yeah, 5-month-old and a 3-year-old.
Okay. And Liza, you really have a newborn. I don't know if I can call my 8-month-old a newborn. So you have a 3-week-old and
a 2.5-year-old.
And 2.5. And so, Brian, you and your wife both work. Liza, you and your husband both work. So how have you folks transitioned, kept, your sanity during these times? Right? We have all this crazy kind of chaos outside, but then also inside, right? Inside the home, we have a bit of change and stress and chaos. So what have you folks done, and what advice would you give to mothers and fathers who are dealing with the same issue? You can go.
So it's definitely challenging, and I wish I had a magic answer for everyone, a blanket answer to make everything perfect. I think with some of it's guilt. A lot of what I'm seeing and experiencing is a lot of the moms are having personal guilt of not being, you see people posting these crazy, like Amanda said, schedules of day to day, hour to hour, minute to minute, and feeling like you need to provide the same thing. So being kind to yourself, not experiencing that guilt if maybe you don't have those schedules. Everybody's house operates differently, and it starts within your household. So ensuring that you and your husband or your significant other have that solid relationship, that the two of you are communicating to start. And then your children are going to be mirroring your emotions and your behaviors, your anxieties. So it's how you're presenting to them and ensuring that even though I might be operating in chaos in my closet for a few minutes and taking those deep breaths and figuring out how I'm going to show up downstairs, it's taking those 5 deep breaths or taking that 10-minute walk to gather myself and then come back as a family and have that discussion, my husband and I, or setting up an activity for the kids so they're not experiencing our anxiety, because kids really don't know. Depending on the age, they don't really know what's going on, and it's really up to us to provide that sense of safety and security to them. When you have a 2.5-year-old who all of a sudden can't see his friends, or you're doing a play date through a window, it's how are you communicating that to them? How are you ensuring, most importantly, their safety? So that would be my recommendation.
And so, Brian, what would you say to the parent who is a business owner who might be having financial chaos or financial stress about their business or their career or job, even if they work for somebody else, or for example, somebody who maybe was just laid off and has to worry about picking up the pieces or stabilizing over the next few months versus being at home and having to be a father, mother, spouse, whatever, and how to balance that when you have those financial and business stressors in addition to parenting and the new norm at home.
Yeah, I mean, it's just there's so many moving pieces to that, right now. As the business owner facing financial stressors, I think doing your research, speaking with your accountant, I know my accountant's already been sending me some stuff on how to get resources and support. But I think doing some information digging and finding out, what kind of support is out there for you to ensure your future, to give you a little more safety and security. There's a lot going on right now for that. Communication, going with what Liza said, communication with your spouse is very important. In the home system, I'm always a big fan of not bringing work into the house with you. I always try to make a conscious effort to breathe it all out before I walk in after a day in the office. I think that's even more important for people now that are trying to work from home.
Right.
If you're in your office space doing your work and then you've got the kids out in the home too, it's a much more challenging, thing to accomplish right now. So I think putting a little bit of effort into trying to maintain that separation and leaving it in the office when you step through that door and function with the family. As a family, a few things that we've been doing is we've been trying to create a few fun routines, the game night stuff, the walks morning and evening together. I've been trying to take the kids off her hands when I walk in the door and say, hey, I'm going to take the double stroller and I'm going to go out for a 3-mile walk here. You relax. Don't worry about dinner tonight. Do that kind of stuff with a 5-month-old and a 3-year-old all day at home by herself. It's a big challenge. So I think just being conscious of that and communicating and setting up that, and then talking as a family about spending. We really went over our budget again. We're very budget conscious as a family, and we sat down and looked through our expenditures, talked about things that that we're what we've got going out and coming in, and looking at what we can cut out. We cut out quite a few things. We canceled some subscriptions and just to give a little bit more peace of mind with what's going on right now. Stop the Amazon shopping, cut out any of the extras to help aid in a little, relief from the financial pressures of right now. Right.
But have you kept Netflix?
I thought the same exact thing, Adam. It's so funny.
Right.
We've got Disney Plus that includes Hulu. So
okay.
we've got that.
Right. Well, they may be coming out with another Tiger King episode, I hear. So.
Oh, yes.
Terrible.
Yeah. But
Adam, one other thing that I just wanted to add, and it's kind of been my mantra lately, and just as professionals, as working full time and parents or whatever we are, spouses, just the mantra is it's okay not to be okay. And allowing yourself that opportunity to just not be okay for once. We're so, especially as therapists, and going in front and being in session and always putting on that face that we're okay, we got this. And allowing ourselves being a little bit more vulnerable, that it's okay not to be okay.
Okay. So you bring up a good point, Liza. Now, is that something that you would advocate sharing with a client to kind of further build that bond, or is that just something for you or us and our spouses and our friends and as people rather than professionals? What would you say about that?
That's something that I typically, even though more so now, it's okay not to be okay, it's something that I utilize often. So telling a client it's okay not to be okay, but going further with that, it's okay not to be okay and feel sad and cry. Absolutely. We want you to experience those emotions. We want you to be vulnerable and experience that. But it's not okay to be sad and engage in self-harm or self-sabotaging behaviors. It's okay to be angry and throw out paper or bang on your damn doll. It's not okay to punch a hole in the wall or punch your significant other. So I think those two go hand in hand. Just allowing them to have those skills, the coping skills to utilize to experience those feelings and not suppress them. Because we want you to experience the different emotions that you're going through during this difficult time and during any other time in your life. It's always encouraged.
Okay, good. So the real last group of questions that I have for each and every one of you is, as leaders in our community, right? We're all small business owners. We're all leaders in our community. Amanda, you've amassed over 13,000 people in the group. You do a lot of other marketing, just a lot of practice building, right? Have you come up with any ideas for the future, for now and 2-3 months from now, just to further help our community? And it can be therapist related. It can be just ways to help first responders, or just again, we're going to get through this, but we need help together, really, to band together. It's like they say, this, in a way, this kind of is a time of war. This is an unprecedented time that none of us in our lifetime have ever really experienced. So have you come up with any ideas or any thoughts of just how we can further band together as a group of people who share a common community?
So I think it really comes down to like the kinds of clients that we work with and just furthering the mission around that. Like I can tell you, like our office, for instance, takes the insurance for Memorial Hospital. And so like we did that purposefully. Why? So then that way, we could service those types of clients. And so just thinking about what kind of practice that you have and like what kind of practice we have, and making sure that you're fully equipped to be able to help those clients. Like, when what happened at Stoneman Douglas happened 2 years ago, HAP came down and did a lot of training for EMDR, right? And so then almost, not everybody, but there's a lot of professionals in South Florida who are now trained in EMDR. We're looking at what kind of trauma our medical professionals are going to be experiencing. So if you're not already trained in EMDR, for instance, like that would be a good thing for our community to get trained in, or some kind of trauma training. Even some, thinking about how we can best serve anybody who's has chronic medical issues, because we know people are struggling with that. So I think just positioning ourselves to be able to serve whoever is going to need our services once we're back to our, what I call our new normal.
Okay, great, absolutely. Brian, Liza, any other ideas or suggestions? Going
off what she said, depending on your practice and your current, clients that you treat, thinking ahead, I work with a not-for-profit organization, and I'm also a therapist on a board for a foundation for first responders and post 9/11 vets. And they've been experiencing some financial difficulties in getting funding to pay for the therapist. So I've been offering pro bono and free therapy to a limited population, a group from the not-for-profit that I work with, and then also from that foundation, because I know a lot of them already have PTSD and struggles right now, and are going to need a little more treatment as the time goes on right now, and feeling the crunch of that foundation losing its funding is really stressful for them. So one thing I'm doing is me, and I've also talked with other therapists in my practice and another mentor of mine, we've discussed a post-COVID sliding scale, pending certain circumstances, job loss, family loss, things like that we're discussing, putting together kind of a plan for financially supporting people that don't have the resources after this to seek help.
Right, and Brian, that's fantastic because there's going to be a lot of people that need it. So we're almost up for time, Liza. I'll give you the last word before we end this.
So I think they did a great job at covering that, and I'll speak a little bit on for Retreat Behavioral Health and just our ability to access more people in the community now. So we are no longer going to be limited to serving the local community, or if there's no outpatient in your 5-mile radius, you can't seek treatment. We have the opportunity now to really cover pretty much any area. So whether you're living in a rural area 50 miles away from an outpatient, you now have access to Retreat Behavioral Health services, which I think is really amazing, which we wouldn't have had before. And also, if you go on to Facebook and like Retreat Behavioral Health, we have webinars. So we just had one on coronavirus and the impact it has on alcoholism. We have a parents chat group that's occurring. We had one last week. So if you go on, there's a lot of different resources. I would encourage you to like that page to get.
So now, Amanda, how can people connect with you if they want to talk to you or need your services?
So we're at Caring Therapists of Broward and Palm Beach on Facebook. You can message us there. All of our contact information is there, and that's the best way to find us.
Perfect. And Brian, what's the best way to get in touch and find you?
Brian Pagan Counseling on Facebook, or you can look up brianpagan.com. Also, I have a profile on Good Therapy and Psychology Today.
Okay. And Liza, you said for the retreat, the best place is Facebook?
Facebook, we have retreatbehavioralhealth.com. We're on, LinkedIn and pretty much everywhere. So.
And for your private practice?
Therapy with Liza. I'm on Instagram, or you can go to Caring Therapist of Broward, and my profile is there as well.
Perfect. All right. Thank you, everybody. I think this has been fantastic.
Thank you.
And have a great day and stay safe.
You too.
All right.
Bye.
Bye.